Hello and welcome. Let us study acute promyelocytic leukemia today. In hematology, this is definitely one of the very heavily tested topics, and I want you to be conversant as well as confident so that you can answer all types of questions that may show up in your exams. Let us begin by understanding the maturation process of myeloid cells. Now, this process occurs in the bone marrow, and the story of the myeloid cell begins with the formation of a myeloblast. The word blast standing for an immature cell, and the word myelo standing for a bone marrow. The end result of this maturation process, after a series of steps, is the formation of neutrophil, an eosinophil, or a basophil. However, the focus for today is going to be on this cell called as the promyelocyte. Now, it is important for you to be able to identify this cell if they show an image in your exams. And it turns out that this is not a difficult process at all, simply because you can find multiple magenta colored granules in the cytoplasm of a promyelocyte, along with the presence of these pale colored areas which are called as nucleoli in its nucleus. With this foundation, we can move to the discussion on acute promyelocytic leukemia, which is also abbreviated as APML. Now, what I have done here is I have created a sketch note. A sketch note basically is a hybrid of sketches and notes, and this is meant to simplify your process of learning. Now, once I finish explaining the process and the entire story of APML, what can happen is, if you have understood it properly, you can take a very quick look at this sketch note and review everything in less than a minute, say 1 day prior to your exam. So let's get going. The whole story begins because of this translocation. This translocation occurs between chromosome 15 and chromosome 17, and this happens on the Q arm, which is the long arm of the chromosome. So this 15-17 translocation leads to formation of a hybrid chromosome called as the PML-RAR chromosome. PML standing for promyelocytic leukemia and RAR standing for retinoic acid receptor. Now, as a result of this translocation, there is something called as a maturation arrest, and we need to understand what this maturation arrest is all about. So if you come back to this promyelocyte, it is meant to progress and form a myelocyte in a normal situation. However, if there is this translocation, the 15-17 translocation that we saw just now, this translocation causes what is called as a maturation arrest, which means a promyelocyte is not allowed to proceed and form a myelocyte. It is arrested at this level. So a myeloblast continues to make promyelocytes, multiple promyelocytes, but they cannot go on and make a myelocyte or any of the cells thereafter. So what happens as a result is there is piling up of the promyelocytes in the bone marrow. And this is the pathophysiology of the formation of acute promyelocytic leukemia. It happens not because of excessive production, but it happens because of maturation arrest, due to which there is a piling up of promyelocyte. Now, this is very important for you to understand when you understand the pathophysiology of this disease. Now, I have tried to illustrate the arrest. Now, you know criminals are arrested, so let us pretend that this is a promyelocyte, and you also know that criminals are not identified by their names, but they are allocated specific identification numbers. And here we have the convenient number 1517, which turns out to be the translocation of APML. So I hope this will help you in remembering the translocation, because this is very high yield, and the vignette, the question stem, often contains the 1517 translocation in its description, and you are required to identify this translocation as an APML. So remember this, because this is very high yield and they will definitely test you. Now, how do we diagnose an APML? It's with the help of what are called as OR rods, and these can be seen under regular light microscope. And these OR rods are basically cytoplasmic inclusions. Now, to identify them, let us go to the right side of the slide and see this photograph, a micro photograph showing a promyelocyte with OR rods. You can see these magenta colored rods. So what are these made up of? These are basically aggregates of the azurophilic granules that you saw in the previous slide inside a promyelocyte. So they crystallize and they form these rod-like structures called as OR rods. Now these OR rods are very important. They are the diagnostic hallmark of APML. So if you are able to see even one cell with one OR rod in it, then you can confirm a diagnosis of APML. So this is a diagnostic hallmark of APML in the peripheral smear. So remember this. There are two ways to diagnose APML. The first one being at the genetic level, where you can do a genetic diagnosis and detect the 1517 translocation, and the simpler one where you can diagnose it on a peripheral smear, where you should be able to identify OR rods. Now, the interesting part about OR rods is that they are thrombogenic. Now, thrombogenic means they can induce the formation of a thrombus. Now, when does this occur? This happens usually after treating a patient with APML, because treatment will lead to bursting of the cells and release of the OR rods. Now, once they are released in the bloodstream, they can start forming platelet clots, and the platelet clots in turn will activate the coagulation factors, leading to consumption of all the coagulation factors, leading to formation of DIC, or what is called as disseminated intravascular coagulation. Now the fatalities that are associated with APML are all related to DIC most of the times. The clinical features are non-descript, non-specific, because they are characterized by either fever or fatigue. Now, how do you treat a patient of APML? Now, there is this very interesting treatment called as ATRA, which was a breakthrough treatment because this was perhaps the first type of leukemia which was completely curable because of initiation of ATRA. Now, ATRA stands for all trans retinoic acid. The second one that is used along with ATRA is called arsenic trioxide. Now, this has been used historically and this has been found to be effective. Now, what happens when you give ATRA? Now, we have seen the role of retinoic acid receptors in the translocation. All trans retinoic acid again uh, is part of the same family of retinoic acids. So, what happens because of ATRA is the arrest is removed, which means the criminal is released from the prison and is allowed to go and is set free. So, if the piled up promyelocytes are released, what will happen is these promyelocytes will start forming myelocytes, metamyelocytes, band cells, and eventually one of the three granulocytes. However, the granulocytes that are eventually derived from the arrested maturation are derived from the malignant promyelocytes. So they are not normal. What happens is because they are come from malignant promyelocytes, they cannot perform the normal functions of the granulocytes. As a result, our body induces apoptosis, which is cell suicide. So these cells are eventually destroyed. But what happens because of this is the piling up stops, the arrest stops, and these cells go on to form apoptotic bodies which can be removed by the macrophages. So this pretty much captures the story of acute promyelocytic leukemia. Thanks for watching.